If you have a dull ache radiating into the back or side of your shoulder, or discomfort lifting objects especially off to the side, you may have a rotator cuff strain. The shoulder is made up of four rotator cuff muscles. These muscles connect the scapula, which is the shoulder blade, to the arm bone, which is the humerus. The rotator cuff muscles act together as a unit to control shoulder motion. So how do you know if you have strained your rotator cuff? A medical practitioner will often perform midline resistance test. In this test, we will place the shoulder in a midline or neutral position. To test the external rotator, you will press out into the external rotation without moving your arm. This is called an isometric muscle contraction. If there is pain or weakness with this test, it may indicate a strain of the external rotator of the rotator cuff, infraspinatus and teres minor. If you suspect your internal rotator is generating pain or discomfort due to the tear, medical practitioner will have you resist into internal rotation. You will press into internal rotation without moving your arm, turning on subscapularis, which is the internal rotator in the rotator cuff. Let's take a look at the medical practitioner performing these tests. So this is the midline resistance test, a test for the external and internal rotators of the rotator cuff. We are going to flex their elbow into 90 degrees and stabilize their elbow. Now we are going to push inwards and ask the patient to hold this position using his external rotators. So this was for the external rotators. Now for the internal rotators, I will pull their arm into outwards external rotation and he is going to hold this position using his internal rotators. Now, a positive test would be if there is any reproduction of pain or symptoms, or if the patient is unable to hold this position. So this was the internal resistance test. In addition, a medical practitioner may attempt to reproduce your symptoms with palpation or stretching. They may palpate or press into the muscle in the back of your shoulder. They will press into external rotators, which are the infraspinatus and teres minor and the anterior part of the rotator cuff. In front of the shoulder, they will press into the internal rotators, which is subscapularis. They may also stretch the muscle in the opposite direction. So stretching the external rotators, infraspinatus and teres minor would be stretching into internal rotation, and stretching the internal rotators subscapularis would be stretching into external rotation. This added palpation and stretching may further rule in the diagnosis of a rotator cuff strain.